Multiple sources have confirmed the rise of bird flu, or H5N1. And while 66 human cases of bird flu were reported in 2024, there were no human deaths in the United States until January 2025. Sadly, the first human death from bird flu was reported in Louisiana 2 weeks ago. And just 3 days ago, on January 16th, 2025, the CDC issued a Health Alert Network health advisory to all healthcare providers. The CDC is warning doctors and labs to watch out for the bird flu virus, also known as H5N1, which can infect people occasionally. Doctors and labs are being told to test patients for flu if they seem sick with flu symptoms and act quickly to figure out what kind of flu it is, especially if the patient is in the hospital or ICU. Although as of now, H5N1 is uncommon in humans, it is more likely to be fatal than H1N1 when a human contracts it. H1N1, which you may remember caused the 2009 global pandemic, is highly transmissible between humans, but less likely to be fatal than H5N1. People most at risk include anyone who has exposure to animals in their jobs, from poultry workers to those exposed to veterinary clinics, according to this article by the CDC published 3 weeks ago on December 30th, 2024. It is also important to keep your pets away from any dead birds in your yard. While the American Veterinary Medical Association confirms it is unlikely for dogs and cats to get it, if they do contract it, it is likely to be fatal. In animals, we are seeing a sharp rise in bird flu. In an article published on Saturday, January 18th, all poultry activities in the state of Georgia have been stopped because of a confirmed bird flu case the day before, on Friday, January 17th. The Washington, D.C. area has also been impacted by this. There are confirmed cases in Delaware and in Maryland in animals. But what about humans? As mentioned before, the first human death from bird flu happened in early January. This patient did have a well-established exposure to H5N1 virus that put them at risk. But more recently, on Thursday, January 16th, a San Francisco resident was the second child in the United States to contract the viral bird flu. The patient had presented with fever and pink eye. This patient is fortunately stable. But how this child became exposed is unclear, because the virus was actually discovered on routine testing. This means that there may be other cases of this that have not been picked up if patients are not coming in for flu testing. In theory, any animal with bird flu should not make it into the food products that humans would eat. But eating raw or undercooked poultry or eggs from infected birds can put people at greater risk, as well as any contact with animals that have it.